Namaste. We all know that eyes are the most beautiful part of the face, and beautiful eyes just light up a face. Now, this video is going to talk about a procedure called blepharoplasty, or surgery of the upper and the lower lids. The idea and the aim of doing a blepharoplasty procedure is to make the eyes more beautiful, make the eye opening more wide, and to remove the fat bags and extra skin in and around the eyelids. I'm Dr. Amit, I'm a plastic surgeon and I'm founder director of Divine Cosmetic Surgery. Please watch this video right till the end. There are many aspects of this video which come up towards the end, which you will not know without seeing them. Now, what is the scope of the procedure that is done? We remove extra skin in the upper lid, we remove extra skin in the lower lid, we can remove extra skin and fat in the lower lid, or we could just remove extra fat in the lower lid. So let's see some examples. Now, the first patient here has got a lot of fat, also a lot of extra skin. So we need to remove both. Also has a lot of extra fat and skin on the top. So we need to remove everything. This patient only needs to do the lower lid, has extra fat and a little bit of extra skin. This patient only has upper eyelid problem. The lower eyelid is fine. Therefore, we only need to remove skin, probably not even fat. In this patient, there is hardly any excess skin, it's only fat. Therefore, we can just remove the fat by special procedure, which can be done from inside the eye without any scar at all. This patient has extra fat and extra skin, so we need to remove both lower eyelid skin as well as lower eyelid fat. A blepharoplasty is a procedure which can easily be done under local anesthesia. We don't recommend doing this procedure under general anesthesia at all. And common presentation, patients complain of droopiness, patient complains of aging, difficulty in seeing clearly, eyes becoming small, and a lot of wrinkle creases and extra skin. We could do blepharoplasty of both the lids at the same time, or we could do it at separate procedures. It is always preferred to do all 4 lids together if needed, reason being a common downtime and a complete 360-degree eye surgery where we rejuvenate the entire upper and the lower lid. The procedure can take 1 hour for either the upper or the lower, or about 2 hours if we have to do both together. The incision, the upper is given in the upper eyelid crease. The incision is invisible. You can't see the scar at all. The lower eyelid can be done in 2 ways. We can do it from just below the hairline, the eyelashes, or we could do it from inside the eye. This approach, the inside the eye, is only done if we need to remove fat and not the skin at all. If we need to remove any amount of extra skin, then we need to do the incision from the outside. The upper eyelid blepharoplasty, we give incision along the lid margin after giving local anesthesia. Remove the extra skin if required, remove the extra fat. Stitches are 4-0 nylon, removed after 5 days. We recommend antibiotics and painkillers for a few days. Cold compression on the eyelids. You can walk the first day itself. No restriction of food or drink except smoking and alcohol not allowed. Travel, shopping, etc. Walking outside 7th day, 3 weeks you can start with sexual activity and sports. There's a lot of swelling and the final shape can take up to 6 weeks. Lower eyelid remains more or less the same. Local anesthesia along the margin, opening up the muscle, taking out the fat. Same suture removed after 5 days and the restrictions remain the same. Now the special form of surgery, the lower eyelid transconjunctival approach, requires a few local anesthesia drops inside the eye, that's it, and the fat can easily be removed. The whole procedure can take only 10 to 15 minutes and there's hardly any swelling at all. Within 3 days, the swelling is gone. The patient can get back to normal activities soon. Now let's review what can be achieved. We see this patient, a lot of extra fat, a lot of extra skin. We did incision from the outside. This is the incision and this is the incision on the other side. Now after about 3 months or so, you cannot even see the incision and there's amazing rejuvenation of the eyelid region. This patient again, incision from outside. You cannot even see the incision. This picture is at 3 weeks. Most of the swelling has gone away. The eyes look so much better and no incision is actually visible at all. This patient only had extra fat. We did not need to remove any skin, so I did it from inside and we can see all the fat gone, no incision. This gentleman went back to office on the 3rd day. One of my first patients, we did all 4 lids together. You can see a remarkable rejuvenation of both the lids. Therefore, my next video is about Asian blepharoplasty. That's a special variant of it, so please do see that, of course. And if you're looking for any eyelid rejuvenation, please do contact any plastic surgeon around your town. If you want to get in touch with us, you can contact us on our numbers, clinic numbers, and do comment. If you like the video, do subscribe to the channel. And if there's any questions, please do put it in the comment box. My team will get back to you ASAP. Have a great day, and namaste again.